All right, let's dive into the fascinating world of operative dentistry. Fillings, restorations, all that good stuff that keeps your smile uh, healthy and bright.
Yeah, it's the art and science behind those seemingly simple procedures.
Right. And we're going deep today with excerpts from a dental textbook. I'm excited to see what kind of secrets we can uncover.
You might be surprised at how much goes into those seemingly simple procedures.
I bet so much happens even before the dentist even picks up an instrument. Like, I've always wondered, what's with all the questions at the beginning, about medical history and all that?
Well, that's a crucial part. It's called taking the patient history.
Oh, okay.
It's like, a detective gathering clues. The dentist needs all those details to understand your unique oral health puzzle.
So it's not just like small talk, right? It's actually really important.
Absolutely. It's way more than just checking off boxes on a form. Like, let's say you mention you're a smoker. That's a huge red flag for a dentist because smoking can seriously impact healing and increase your risk of gum disease.
Oh, wow. I didn't realize that.
Yeah. Or maybe you're taking medication for high blood pressure. Well, certain medications can cause dry mouth. And that can lead to, a whole other cascade of problems.
Okay, so those questions, those seemingly random questions, are super important.
They really are. They're like pieces of a puzzle that help us create the best treatment plan for you.
Gotcha. Speaking of detective work, what about the tools? I mean, obviously, x-rays are a given, but what other high-tech gadgets are out there?
Oh, there are. There's a bunch. We still rely on the classics, of course.
Like what?
Like visual and tactile exams.
Right, actually looking in your mouth.
Yeah, actually looking in your mouth, feeling around for anything unusual.
Makes sense.
But technology has given us some really incredible tools. We've got digital radiography.
Oh, those fancy 3D x-rays.
Yeah, exactly. They give us an amazing detailed view of your teeth and jaw. But even the standard bite wing x-rays are really helpful. They're essential for detecting cavities, those sneaky ones hiding between your teeth.
Oh, wow.
Yeah. And they even help us determine how severe the decay is.
Huh. So x-rays can show how deep a cavity is. That's pretty impressive.
They can, but it's important to remember that x-rays are just, they're 2D images of a 3D world.
Right, right.
So sometimes they might miss those very early stages of decay.
That makes sense. So it's still really important to have, that hands-on exam too,
Absolutely.
Right?
We always combine our clinical judgment with the x-ray findings to get the full picture.
Makes sense.
Yeah.
So, what else do dentists look for, besides those obvious cavities?
Well, you'd be surprised how important those contact points between your teeth are.
You mean where your teeth touch each other?
Exactly.
Right.
Yeah. If those contacts aren't shaped or positioned correctly, well, it can cause all sorts of problems. It's like a building with poorly fitted bricks.
Yeah.
Things start to crumble.
Oh, so faulty contacts can actually, mess up your whole smile.
Exactly. Food can get trapped, leading to gum disease, shifting teeth. Oh, it can even affect your bite and cause headaches.
That's a domino effect.
Yeah, it really is. That's why dentists pay so much attention to them, especially when placing fillings or restorations. We want to make sure everything fits just right.
So it's all connected.
Everything's connected. It's like an ecosystem in there.
So, all right, let's say you've looked at my teeth, you've taken x-rays, you've poked and prodded.
Right.
And you've decided, okay, this person needs a filling.
Okay.
How do you choose which type of filling is best?
Well, that's where treatment planning comes in.
Uh-huh.
It's a multifaceted process that takes into account your individual needs and preferences.
I was going to say, some people probably care more about how the filling looks than how long it lasts, right?
Absolutely. We consider everything. Your preferences, your overall health, financial considerations.
Okay.
It's truly a collaborative effort. We guide you through the options. But ultimately, you are in the driver's seat of your oral health journey.
I like that, being in the driver's seat. That's a good analogy.
Yeah. We're here to navigate the road with you, but you're the one who decides the destination.
So you're saying it's a partnership?
Exactly. A partnership for a healthy, lasting smile.
I like it. A partnership for a healthy, lasting smile. That's a good takeaway. All right, so we've talked about patient history, those high-tech tools, and the importance of those contact points. And we've even touched on treatment planning. It's amazing how much goes into creating a healthy smile.
It really is. And we're just getting started.
I know, right? There's still so much to uncover. So stay tuned, folks, because we're about to take an even deeper dive into the world of operative dentistry.
We'll be looking at different types of restorations, materials.
And we'll be talking about those dreaded root canals.
Yeah, we'll demystify root canals. Don't worry, they're not as scary as they sound.
We'll get to the root of the matter, so to speak. So stick around, because this deep dive is just getting interesting.
Absolutely. It's going to be a fascinating journey into the world of teeth.
Buckle up, everybody.
A partnership, exactly. So now you've got the treatment plan, right?
Right.
What next?
Well, I would assume, you go straight to drilling and filling, right?
Well, hold on. Not so fast. We got to talk about restorations.
Yeah.
Sometimes it is a simple filling.
Okay.
But sometimes it's more complex and might require an indirect restoration.
An indirect? What's that?
So those are made in a lab and then cemented onto your tooth.
Oh. Well.
Think crowns, bridges.
Okay, so this is why it's called operative dentistry. It really is like a whole operation.
It can be, yeah.
But let's go back to fillings for a sec. I know there are different materials like amalgam and composite.
Sure.
What are the pros and cons of each?
Right. Well, amalgam, those silver fillings you might have seen, they're super durable. They can last for decades.
Really?
Yeah, but they're not exactly, winning any beauty contests. Composite fillings, on the other hand, they can be color matched to your natural teeth, so they're practically invisible.
So if I'm getting a filling on a front tooth, I'm definitely asking for composite.
Probably a good idea. But it's not just about looks, composite fillings. They require a bit more finesse to place. They might not be the best choice in areas with heavy biting forces.
Oh, okay. So there's a lot to think about.
There is, yeah.
This is making my head spin a bit.
It's a lot, yeah.
Say, while we're on the topic of teeth, what causes that awful sensitivity when you bite into something cold?
Ah, yes, the dreaded tooth sensitivity.
Yeah, it's the worst.
It's technically called dentinal hypersensitivity, and it all comes down to those microscopic tubes inside your teeth called dentinal tubules.
The dental tubules, are those the things that connect to the nerves?
Ringo, when those tubules get exposed, either from receding gums or worn enamel, it's like opening up a direct pathway to those nerves.
Mm-hmm.
So that cold ice cream, it triggers a rush of fluid movement in those tubules, and your nerves are like, whoa, what's going on here?
Oh, ouch. That's no wonder it's so sharp. So what can you do about it?
Well, the good news is there are lots of options. For mild cases, a desensitizing toothpaste might do the trick. It basically plugs up those exposed tubules and helps block those sensations.
Okay, so it's like a shield for your teeth.
Exactly. Now, if the sensitivity is more severe, we might recommend something stronger, like a fluoride varnish, or even a filling to cover the exposed dentin.
Okay.
And in some cases, gum grafting can help too if the sensitivity is due to gum recession.
Right, right. Speaking of gums, I know dentists always harp on the importance of good oral hygiene.
Yeah.
But what's the big deal with those regular cleanings anyway?
Yeah. Well, those cleanings, those are your secret weapon against gum disease.
Oh.
And a whole host of other problems.
Well.
You see, even with the best brushing and flossing, you can't get everything.
Okay.
Professional cleanings remove the stubborn plaque and tartar that builds up over time.
So it's like a deep clean for your teeth and gums. But isn't that what flossing is for?
Flossing is super important, don't get me wrong.
Right.
But even the most dedicated flossers can't always reach those tight spaces between teeth. Plus, we use special tools to clean below the gum line where the real trouble can start.
So you're saying those cleanings are worth the time and effort?
Definitely worth it.
Okay, all right. I got to ask, are all those shiny instruments really necessary? Some of them look kind of intimidating.
They might look scary, but they're all designed for very specific tasks.
Okay.
Think of it like a chef having different knives for different jobs.
So it's all about precision and efficiency.
Exactly. We have instruments for examining, for cleaning, for removing decay, shaping fillings, you name it.
Wow. Are there any, particularly cool or high-tech instruments that you use?
Oh, absolutely. We've got ultrasonic scalers that vibrate plaque and tartar away, and even lasers for certain procedures.
Oh, lasers. That sounds straight out of science fiction.
It might sound futuristic, but laser dentistry is becoming more and more common. We use them for everything from removing decay to reshaping gums.
Wow, that's pretty amazing.
It is.
Okay, switching gears a bit. I know a lot of people dread root canals.
Yeah.
But I've heard that they're not as bad as their reputation.
You've heard right. Root canals actually relieve pain, they don't cause it.
Oh, okay.
They're designed to save your tooth when the pulp inside gets infected or inflamed.
So it's like a last resort to avoid extraction.
Exactly. We remove the infected pulp, we clean the canals, seal them up tight to prevent further infection. It's like giving your tooth a second chance. And most of the time, it works like a charm.
Well, that's reassuring. Now, I know we have some listeners who are, getting up there in years, like myself.
Sure.
What are some special considerations for older adults when it comes to oral health?
That's a great question. Geriatric dentistry is a whole specialty that focuses on the unique needs of older adults. Things like dry mouth, receding gums, even the medications you take can impact your oral health in different ways.
So it's about adapting dental care to meet those changing needs.
Exactly. And it's not just about treating problems, it's about preventing them in the first place. That's why regular checkups are even more crucial as we age. Early detection is key.
That makes sense. So is there anything, outside of the dental chair that people can do to, boost their oral health?
Absolutely. There's this growing movement towards holistic dentistry, which recognizes that your oral health is intimately connected to your overall well-being.
So it's not just about teeth and gums.
Not at all. Holistic dentists look at the big picture. Your diet, your stress levels, your lifestyle choices, it all plays a role.
Okay, I'm intrigued. Tell me more about this holistic approach.
Well, for instance, chronic stress can weaken your immune system, making you more susceptible to gum disease, or a diet high in sugary drinks. Well, that can wreak havoc on your tooth enamel.
Yeah.
Holistic dentistry is about addressing the root causes of oral health problems, not just the symptoms.
So it's a more like preventative approach.
Exactly. It's about empowering you to take control of your oral health and understand how it impacts your overall well-being.
That makes a lot of sense. Now I have to ask about something that's been in the news a lot. Those silver fillings or amalgams. Are they safe?
Amalgam fillings have been used for over a century and are known for their durability and affordability.
Yeah.
However, they do contain mercury, which has raised concerns for some people.
Right. So are they something to be worried about?
Well, the amount of mercury released from amalgam fillings is very small, and it's generally considered safe by major dental organizations like the American Dental Association.
So like the benefits outweigh the risks?
According to the current scientific consensus, yes.
Okay.
However, it's ultimately a personal decision. If you have concerns, talk to your dentist about the pros and cons of different filling materials.
Right. Speaking of replacing teeth, what about implants? They seem to be all the rage these days.
Implants have become the gold standard for replacing missing teeth. They're basically tiny titanium posts that act like artificial tooth roots.
Okay.
Once they fuse with your jawbone, we can attach a crown, a bridge, or even dentures to them.
So they're like a permanent solution.
That's right. Implants are incredibly durable, stable, and they look and feel just like natural teeth. They've really changed the game for people who have lost teeth.
That's fantastic. Now, I have a confession to make. I clench my jaw, especially when I'm stressed. Could that be causing problems with my bite?
You're not alone. Many people clench or grind their teeth, especially at night. It's called bruxism.
Oh, right.
And it can put a lot of stress on your jaw muscles and joints.
And I'm guessing that's not a good thing.
Not really. It can lead to jaw pain, headaches, even tooth wear and damage. In some cases, it can even affect your bite, or occlusion, as we call it.
So how do you fix a bad bite?
Well, it depends on the cause and severity.
Okay.
Sometimes it's as simple as adjusting a high filling, but other times it might involve orthodontic treatment, like braces or clear aligners.
So it's not just a cosmetic issue.
Definitely not.
Yeah.
A healthy bite is essential for proper chewing, speaking, and overall jaw function.
Wow.
It can even impact your sleep and breathing.
Speaking of sleep, I've heard there's a connection between sleep apnea and oral health. Is that true?
Absolutely. Sleep apnea, where you stop breathing momentarily during sleep, can actually wreak havoc on your mouth. People with sleep apnea are more prone to dry mouth, teeth grinding, even gum disease.
Wow, I had no idea. So taking care of your sleep is important for your oral health too.
It really is. It all comes back to that connection between oral health and overall well-being.
It really is fascinating. We often think of our mouths as separate from the rest of our body.
Right.
But everything's interconnected.
It really is.
Okay, last question before we wrap things up.
Sure.
I know some people have, a real phobia of going to the dentist.
Yeah.
Any advice for them?
Dental phobia is very real and can be incredibly debilitating. If you struggle with it, the most important thing is to find a dentist who understands and can work with you to make your experience as comfortable as possible.
So, like, communication is key.
Absolutely. Don't be afraid to share your fears and concerns with your dentist. There are also techniques like sedation dentistry that can help ease anxiety.
Okay, that's good to know. It's great that there are options available for people who need them. This has been such a fascinating deep dive.
It has.
I feel like I've learned so much.
Me too.
You've demystified a lot of things for me today. I bet our listeners are feeling a lot more informed too.
I hope so. Knowledge is power, especially when it comes to your health.
It really is, yeah.
Yeah.
And I think our listeners probably feel a lot more empowered too, now that they know more about what's going on.
I hope so, yeah. Knowledge is power.
Exactly. So before we wrap up, is there like one final thought, maybe something provocative that you want to leave our listeners with, about operative dentistry, something to kind of ponder?
Well, we've talked a lot about the technical stuff, right?
Yeah.
Right. But I think it's important to remember that, there's a human element to all of this.
Oh, yeah, for sure.
I mean, every tooth we treat, every filling we place, it's all part of someone's unique story.
That's a beautiful way to put it. Like every tooth has a story.
Exactly. And as dentists, we're not just fixing teeth, we're helping people live better lives. We're restoring their ability to eat, to speak, to smile with confidence.
And that confidence, that can have such a huge impact on, their relationships, their self-esteem, everything.
Absolutely. It's a ripple effect.
Yeah, it really is.
So the next time you're in the dental chair, remember, it's not just about the procedure, it's about the person behind the smile.
That's a powerful message to end on. Thank you so much for sharing all of this with us. This has been a really incredible deep dive into the world of operative dentistry.
It's been my pleasure.
And to our listeners, we hope you've enjoyed this journey as much as we have. Remember, a healthy smile is a reflection of a healthy you. So keep brushing, keep flossing, and keep visiting your dentist. Until next time, keep those pearly whites shining.